Hartford HealthCare is an integrated delivery network where we have 6 hospitals, we have ambulatory care facilities, we have a partnership for surgery centers as well as radiological imaging centers. We have a home health network. We have a variety of services, really comprehensive services across northern and central Connecticut, across the state. We have our 5 community hospitals that refer into Hartford Hospital, typically for tertiary care and for a lot of surgical work. Hartford Hospital is known for its surgical theater and for the work that we do. We're also affiliated with University of Connecticut. We have residents in our training and academic facility, teaching facility. We are affiliated with Memorial Sloan Kettering and the Cancer Network, and we've done some preliminary work with them in terms of being able to share images and to be able to share our patient information with patients who participate in clinical trials. Because of our growth, we had some very peculiar needs. The hospitals all had different PACS solutions, and because they're referring facilities, the need to move images from location to location is pretty significant. And so, we started our Epic journey in 2014, and related to that, we now have all the hospitals live on Epic, and we're moving patients from one location to another. We also have the need to have those images. So, just like in the Epic story, when you get transferred from one emergency room to another, your record beats you there. We'd like the images to beat you there. Dr. Barry Stein actually conceived the Image Connect project. He's a practicing interventional radiologist, and he basically put together the whole concept of being able to move images and being able to capture images and deliver them. And he's really, represented the radiologists as well as the practicing physicians who need access to images, surgeons and others. Our vision is to be able to deliver an image anywhere, anytime, any place. And that's an important component, and that's how we started our journey for the VNA. So we implemented the VNA and moved them all to a Sectra VNA so that we have ready access. It's also closely integrated with Epic, so it gives physicians access through Epic as well to the image, and not necessarily directly, having to access the VNA. The images are associated or affiliated with the patient, and therefore. But it comes back to having a single index and an easy way to identify all the images that are related to a particular patient and whatever priors they might have. So that's the core of it. So one of the keys in selecting Sectra and really the tools that we have is the universal viewer. What we wanted to be able to do was to have, one tool that the physicians would get trained on and that would have, and from a use perspective. And that's the universal viewer is what they use to view images. And that's an important concept relative to not having to train physicians over and over, not having to affiliate multiple viewers like we used to have to do in the past with mammography or different types of technologies. It was part of, Dr. Stein's whole vision to be able to, really make it easy to use, easy to access, and then, of course, tightly integrated with the indexing that we do on Epic so that patient records, match the imaging part. The other piece that's important is not having to duplicate imaging, when you already have it. I mean, it's not just it is for patient safety because you don't want to over-radiate the patient, but you also, it takes time to do that. And so it delays care, if in fact you don't have prior images or if you don't have related images from the patient coming in, they might want to see what the current, state needs to be if they don't have something that's relatively current. And that has a big impact on the speed with which decisions can be made and the treatments can be developed. And as we went through our Epic install process, we installed, facility after facility. And so we would convert the imaging solution at the same time that we converted to Epic. We would typically try to convert 2 to 3 years of prior images before the live event. And then, so they would be readily available as we went forward. And then all new images from that point forward would obviously be available as well. So it gave us a little bit of a historical perspective as well as, all new imaging that might be created. I guess in the final analysis, the impact of putting in a VNA, really has changed our health system. It has changed, the patient care that we provide. It has changed the way we're able to, care and receive and treat patients. It's really phenomenal. I mean, in our business, and especially from an IT perspective, you don't often, necessarily feel directly connected to care. And so it's really been amazing to be part of that in implementing Image Connect and really the Sectra solution. And in particular, even the Univiewer that we used, I mean, that made a huge difference. We have phenomenal aspirational goals to expand our services and to expand the VNA. We have a couple of key parts where we want to expand into other ologies. We want to do full motion video. We want to incorporate, we go through with the radiologist to prioritize the imaging that we want to collect. We also want to extend our reach into physician practices. Physician practices generate a lot of images, and we want to provide a resource for those to be able to come. We also want to end the CD carry business, in terms of being able to upload images from referring practices that even aren't affiliated with us or aren't, but the patients are being referred to our facilities or our doctors. We want to get those images incorporated as easily and quickly as possible. At the end of it all, it's all about the patient. And I think that's the wonderful thing about both these companies and our company as well, that we are strongly focused on that, and that both Epic and Sectra are focused on improving care and really making it easier for physicians and everyone to interact with the patient and deliver high quality care in a very easy and safe way.